Tragedy struck Tallahassee yesterday, and Tallahassee Memorial Hospital is the hospital that received patients from that incident. And it does seem like all 6 of the patients that made it to the hospital are going to make a full recovery. This is unfortunately something that is more and more common, to the point that we are running drills at least yearly to make sure that we are prepared for when this happens. Not if it happens, but when it happens. What does it look like actually in the hospital when these events are occurring? So the first thing is that we need some sort of notification. Sometimes that comes from law enforcement, EMS, someone just calling in. Sometimes even we see it on social media or the news. And then we send out kind of a mass page or a mass notification to the staff that there is a mass casualty incident that is going to happen. And what that does is it calls in all of the staff to generally a check-in location. And we need a lot of staff on board. So most people think doctors and nurses, but there's a lot of other people that are important in this response. Yes, doctors are important. So we've got the trauma doctors, the ER doctors, and then the specialty doctors, the neurosurgeons and the orthopedics. We also need the nurses, we need the respiratory therapists, and we need the OR staff, stat. We also need radiology. We need the radiology techs, x-rays, CAT scans, so that we can get patients in and see what's actually going on with them internally. Probably one of the most important people is actually environmental services. They're going to bring down a ton of wheelchairs and stretchers so that when the patients come from the ambulance bay or through triage, that we actually have a place to put them, that we can transport them instead of like carrying them on our backs. It's also really important that we decompress the hospital so people that don't need to be there can go. If they're ready to be discharged, they need to go. And then we need to get those rooms turned over so that the next patients are ready to go in there. Pharmacy is also really important. They're going to bring some medical bags with very specific medications to manage these trauma patients, things like TXA, IV fluids, medications to relax patients for intubation, antibiotics, and pain control. Blood bank, also super important. They're going to be preparing large amounts of generally whole blood, sometimes massive transfusion protocol, depending on the hospital. In Vegas, they just had bins of O positive blood that they gave to men and O negative blood that they gave to women because there were so many people impacted there. Patient registration is also really important so we can identify the people, find next of kin, and then we also have our unit secretaries, child life, social work. There are so many people that are involved. It really is an all hands on deck, and every single person has an important role. This one hit close to home. I'm a graduate of FSU. I lived in Tallahassee for several years, and watching the press conference, I saw one of my medical school colleagues, Dr. Graham, was the ER doctor that was sitting up among all of physicians that helped take care of the patients yesterday. This sucks. This sucks. And I want you to know that it doesn't have to be this way. We don't have to keep doing this.